So it's a BLS response to a 39-year-old male, because that would be BLS chest pain. If he was 40 or over, they'd give him that unit. But 39-year-old male, chest pain. That's what the call comes out as. So on the way to call with my partner, Heather, hey, so when we get there, if you just want to grab a set of vitals, that'd be awesome.
Absolutely.
And I'll start interviewing. And so we pull up to the house. Looks like a single family home, middle class. Yard looks maintained. Looks like there's some snow on the ground and a shovel kind of blocking the driveway. No signs of like safety issues or concerns. We have our full PPE on. So we knock on the door. Hey, fire department, anyone home?
Yeah, come on in, the door's open.
Okay, thanks. So dispatch aid 164 patient contact. That one patient, he's sitting in an upright position holding his chest. This would be a nature of illness type call. Doesn't look too comfortable, skin's a little flushed, but dry. So let's come in here and see what we can do. I'm not considering C-spine on this one. So, hi sir, my name's Gabe. I'm with the fire department. What's your name?
John.
John, hey, I'm just getting your pulse here. My my partner, she is going to take vital signs from you here. So his skin is dry, it's warm, it's pink. So you gave us a call today.
Yeah.
What's going on today?
I don't know, I just got up this morning and it's cold outside and I just went outside like I normally do and just gonna shovel, the pathway to my car so I could go out to the gym.
Okay, all right. And this
yeah,
came on?
Yeah.
So this happened, how long ago was that when you were out there?
Oh, shoot, what time is it? I don't know, 10, 15, 20 minutes ago.
10 or 15 minutes ago.
Kind of come in, sat down, and it would go away again.
Okay. Have you ever had this feeling before at all?
No, I mean, I have like some I don't know, indigestion or something.
Okay, all right.
sometimes,
Does
so-
it feel like indigestion to you?
Yeah, that's
It
what I'm
feels-
thinking it is.
Okay, but just not sure.
Yeah,
I gotcha.
Yeah.
All right. So you said you were shoveling snow. Does this feel like a muscle strain at all to you?
No, man. No.
I know you're in
Yeah.
obviously better shape than me. So
yeah,
I'm gonna just push
Yeah.
on your chest really quick here to see if that changes anything. Push inside.
No.
You mind if I take
Yeah,
a quick
that's
look?
okay.
Good. Okay. Awesome. So nothing looks odd there to me. What do you got for vitals?
I got 140 over 100
140 over 100.
with a rate of 88 strong and regular, starting at 98.
140 over 100, starting at 98,
That's a little high.
rate of 88. Okay,
Little
all right.
I'm feeling pretty good though.
Okay.
Yeah, I'm not.
Yeah, so it sounds like you're out there 15, 20 minutes ago, this is going on.
Yeah.
How would you describe what you're feeling?
Just uncomfortable.
Uncomfortable,
Yeah,
okay.
uncomfortable.
Does it have any word that you could say? How would you give me whatever you're feeling?
Like if I just kind of squeeze you a little bit.
Okay,
you know,
kind of a
just
squeeze
push.
feeling,
Yeah,
okay.
yeah.
So on a scale of 1 to 10, 10 being the worst discomfort, 0, where are you at?
Maybe a 1 or 2.
Okay,
Yeah.
and has it been the same the whole time?
No, when I was out working, it was a little bit worse, but I mean, I think it. Like I
So
said, I guess
subsided
it
a little bit.
reflects, whatever it takes.
Okay.
Tums usually, but.
Okay.
So.
Okay, I'm gonna, would you mind calling, getting a medication coming
Yeah.
just for chest
Dispatch
pain?
164 medic for cardiac
Okay.
eval.
So if you had I heard you kind of coughing, have you had a cough at all?
No.
When you cough, does that change that?
It's a little bit more uncomfortable, I guess.
Okay.
But, no.
What about if you take in a deep breath?
Yeah, a little bit, but.
A little bit?
And that's
Okay.
like I said, sometimes when I just get this stomach stuff, it just kind of
Okay.
feels kind of like that, but.
So any breathing difficulties at all?
No.
Okay.
No.
All right. So no breathing difficulties, and then anything that you can do that maybe changes it, makes it better, makes it worse.
No, I mean, I don't know, just kind of, I'm not really comfortable.
Not really comfortable.
Yeah.
Okay. And then let's just talk about a few other things.
Okay.
So first of all, just to let you know,
Okay.
we have some paramedics coming also. They're gonna,
Something wrong?
yeah, no, we just want to make sure this isn't a heart issue.
Oh, okay.
And so they can put on and take a better look at your heart than we can. But just some more information for us so we can pass it on to them. Did you get sweaty at all with this event?
Yeah.
Okay.
Yeah, a little bit.
When
Yeah.
it first
'Cause
started?
I wasn't working that hard. That was also what was weird.
Okay.
I mean, shoveling snow is like not a big deal.
Because you're
Yeah.
not sweaty now.
Yeah.
So since his blood pressure wasn't greater than 180 over 110, sir, do you take any medications?
No.
Okay, no
Kinda
medications?
Just one little weed every once in a while.
Okay, I figured.
Yeah.
So that's okay. It's legal and stuff.
Yeah.
That's cool. So no medications, allergies to medications at all?
No.
And have you ever had any ulcers or bleeding, any blood in your fecal matter?
Not
Okay.
really, no.
So let's get some aspirin going on here. And so I'm not seeing any like bilateral weakness or anything, so I'm not suspecting a stroke at all. So these are 4 baby aspirin. We're just gonna have you chew these up.
Okay.
I'm gonna notate the time.
Okay.
08:23.
Alright, there's your 4.
Awesome. Have you had any nausea, vomiting?
Yeah, maybe a little bit.
A little bit of nausea.
But
Okay.
just kind of feeling off.
Okay.
Yeah.
All right. And so his O2 sat was 98%, so I'm not going to put him on O's, but I just want to take a quick listen to your lung sounds.
Okay.
Just see how you're doing. I'm going to just have you lean forward a little bit. I'm going to listen to 6 spots here, so I'm going to just have you take a breath in through your mouth and out. Go. Perfect. And then final 2, I just got to come in from the top here.
All right.
Okay. Perfect. Okay, you can go ahead and lean back there. So how about we get a second blood pressure on the other side?
You got it.
Bilateral blood pressures with chest pain. So we're getting the second one. I'm gonna just kind of recap here. So my partner knows also. So a 39-year-old male about 15-20 minutes ago, he was outside kind of shoveling when he got some kind of chest squeezing discomfort. It was about a 3 on a 10 scale at that point. Said it didn't go anywhere else. And it got a little sweaty and nausea with it. Kind of subsided a little bit. So it sounds like he doesn't take any medications or anything, pretty healthy except GERD. So let me ask you this question. Do you have any family history of heart problems?
Heart problems.
Yeah, like heart attacks, high blood pressure,
Yeah.
high cholesterol.
Oh yeah, my uncle, I think he had a heart attack.
Okay, all
I
right.
think he did.
How old was he?
I think he was like 46.
Okay, so
44
pretty young.
around there.
Okay.
And then my dad, obviously, kind of the same. He's always had like heart troubles. And
Yes,
I
okay.
think he had, I don't know, like where they fixed the heart, like put something in the heart, make
Yeah,
it work.
yep,
You know,
okay.
not like a pacemaker or something, but
Okay.
I'm talking about like where they
Yeah.
try to help them open it up or something. you know?
Oh, the stents.
Yeah, a
Stents.
couple of those.
Okay.
Yeah.
Okay. So you had a stent. Okay. That's good to know. How about, and I know you said, hey, medics here.
Yeah.
Awesome. So I'm going to just let them know what's
Okay.
going on. Hey, paramedic Keys.
Keep going, I'll just listen. I'll just
Okay.
listen.
Okay. Yep. Are you on? You must be 123. Okay. So, just joking.
Fast response.
So I think, so we gave you some aspirin there.
Okay.
The paramedics are gonna hook up some stickers, kind of
Okay.
get a better look at that.
Sure.
Okay.
I think, I've kind of got the info from you, so I'm gonna just pass it on.
Okay.
So,
Yeah, what's up?
hey, so paramedic Keys, this is Nick, he's 39 years old. He was outside today, shoveling some snow when he got a sudden onset of kind of a substernal, he called it a discomfort squeezing.
Okay.
Non-radiating. At first it was kind of a 3. He got nauseous at the time, he got a little diaphoretic. That's subsided along with the pain has gone down to about a 1. But significant family medical history of both dad and uncle having heart attacks or cardiac issues in their 40s.
Okay.
Vital signs are good. Blood pressure is 140 over 80. Heart rate's 88. Strong and regular. He sat at 98% on no O2 on room air.
Okay.
He only has a history of some GERD. He does not take any medications at all. He smokes a little marijuana once in a while, and that's about it.
Okay.
So if you guys wouldn't mind checking.
So I got Heather putting the 4 lead on, so she's gonna do that.
Stickers, sir.
Hey, sir.
Hi.
They said your name's Nick, is that
Yeah.
right? My name's
Yeah.
Megan.
Yeah, is everything all right?
Those are equal
And there's a lot of you guys here.
Yeah, so Heather put these stickers
Yeah.
on. What I'm gonna do is I'm gonna.
Oh, paramedic
Yep.
Keys, I'm sorry. We did give him aspirin
Okay.
at 8:23 a.m. We gave him
Great.
324 milligrams of aspirin.
Okay. So I'm gonna ask some of the same questions that Gabe just asked, and I think what we're gonna do is put some more stickers on your heart. Have you ever had a 12 lead before? Or an EKG?
No, I don't think so.
Electrocardiogram?
No.
Okay.
I know they did that for my dad.
Yeah,
He was-
so
yeah.
so we're gonna do the same thing, basically take a picture of your heart.
Okay.
And what that does is it just gives us a look at what's going on with the electrical activity in your heart right now.
Okay.
The way you're describing this though, whether we see anything or not, I think you get a trip to the hospital today.
Sure.
Yeah. Yeah.
Can we sit here and chill out? I mean,
With your
it's just
family
go away.
history, I think it's prudent, right? So,
Am I having a heart attack?
well, that's what we're most concerned about. That would be worst case scenario. So that's what we're gonna find out. So,
Okay.
mind picking your shirt up?
Yeah.
Just gonna Heather put the stickers on for me. Okay. So these are gonna go around the left side of your chest here.
Okay.
Cool. Put that up. Heather's also got my blood
I'm
pressure
gonna
cuff
put your
on.
last name.
Yeah. You said you're 39?
Yeah.
And he's a dude. Okay. There we
There's
go.
a life pack here, we're putting
Yeah.
information in.
All right, so no talking.
Okay.
Just sit still, nice and comfortable for about 20 seconds here. Willis takes a look at that.
Do you want me to get your gurney?
Not yet.
Okay.
If we don't see anything, you might go with you guys.
Okay.
Yeah. All right. Oh yeah. All right. Hey,
She's
partner,
reading
that-
she's reading the 12
Do you
lead like
want
the
your
medics.
gurney?
Hey partner, that looks like a STEMI.
I'll go get your gurney.
All right.
Okay.
So here's what I'm gonna
We're
do.
getting
I'm
the
gonna call the
gurney.
doc. You guys are gonna move him, and you guys are gonna move him. He's
Yeah.
not working at all.
You got it.
There we go.
Okay, so we bring our gurney in, and what she said, you guys are gonna move him, meaning we're not even gonna let him stand up. We're gonna pick him up and put him on the gurney because we do not want his heart to exert anymore because he's having a big heart attack.
Should we get an engine for personnel?
With this guy, yes.
And I'd be like, so hey Nick, it does look like you're having a heart attack. Here's what's gonna happen. These guys are gonna get you on the stretcher. We're gonna get you out of here. We're gonna get you to the hospital. When we get in the back of the rig, my partner's gonna start an IV. We're gonna give you some medicine. Okay? I'm gonna call the doctor and let him know they're coming.
Okay.
Do you have any family that we should call?
No.
All right.
I'll call my dad later on. I don't want
Okay.
to worry him.
All right. Yeah. So we're gonna get you to the hospital. I'm gonna give them a call right now so
Okay.
they can be ready.
Okay.
And I think you're gonna go to the cath lab today. All right.
Megan Keys for paramedic. So how did that go for you guys? Do you see how it's totally different? Does it seem harder? It is, because you're having to ask a human being questions. You're having to hear the answer. You're having to think, does that mean anything? And then you have to figure out, is that going to adjust my next question? It's hard. That is challenging. I do not expect today for all of you guys to figure this out. But what I want you to start doing is maybe you aren't going to necessarily understand why certain things he says are important, because that will come over the next few weeks. But what I want you to get understanding is make sure you're figuring out the questions you need to be asking. So I don't expect you to go, when he tells me, yeah, I have upper GI pain. I don't expect that to immediately elicit some sort of response. But what I do expect you to do is notate that, because that is really challenging when you're stressing out about thinking, what is the next question I need to ask? I sometimes people will say something really off the wall and your brain doesn't even process it because you're already thinking about the next question. So did you notice how I did those little recaps? You see how many times I did that? I did it like very affirmatively one time, but a lot of times I would repeat back to Nick and I'd say, okay, so let me just make sure. So about 15, 20 minutes ago, you're outside, you're shoveling, and something happens. I'll tell you why I do that, because when I was first in EMT, I could never remember what people were telling me because I was so nervous, especially, I will be honest, when I heard medics were coming, I'd be like, oh no, I think I'm so done there, I think I'm done. Because I worked in South King County and that's how they would make you feel a lot, especially when you were new. That's just the way it was. And so I would get so nervous about not looking right because, you know, as a firefighter, what's your number one thing you have to do? Look good, exactly. And so I would really worry about it. And so what wasn't happening was I wasn't getting that stuff in my brain. So as soon as I started kind of having those little recap conversations, things got really much better for me in my career. So think about that and try to, and we're just gonna take it slow today. So since this is your first day doing medical, Firefighter Reed and Firefighter Almost Lieutenant Tusing will be in your medical shortness of breath respiratory setting. And on all the medical ones, Firefighter Skoda, Firefighter Keys, it's not just gonna be, we're not expecting you to walk into those scenarios and just be doing a scenario. This is gonna be an opportunity for the instructors to teach a little bit. It's gonna be really slow today. Day one medical, nice and slow. We don't want you getting into any crazy things. Sometimes it's BLS, sometimes it's ALS. Could I have a BLS chest pain? Oh my gosh, my chest hurts so bad. Oh, what were you doing when it started? I was bench pressing 225 pounds. I wanted 245s, plates on each side, and I realized I can't do that. I tore something, so BLS chest pain. Then there's the kind of tricky ones. Like this could have almost been tricky if he had started like really forcing the fact of, nah, this is just my indigestion, and it feels like my indigestion. Then I'm kind of in a spot of like, well, is this medic? Is this a sick patient or not? So it's making those decisions, and your instructors will help you with that. Question?
Yeah, what led to the STEMI over a stable angina there?
Just the fun of it.
I mean, like signs-wise, because I'm kind of.
Oh yeah. So there is no difference. You cannot tell. Someone can have a chest pain, and it can be angina, and it can be a STEMI. You're not going to know just from a person telling you.
Okay, so that's where the medic placing the 12 lead on is.
Exactly.
Tell us? Okay.
Yep. So for instance, now with him, in my mind, I didn't know what he's making up in his mind. In my mind, he was having angina because he was exerting himself. So angina normally starts with exertion and calms down with less exertion. But a STEMI can do exactly the same thing. So I'm thinking, it's just going to be angina. The medics are going to give him some nitro, take him. And then when she pulls out the 12 lead, does that, STEMI. Then you hear STEMI and things better start moving fast. I mean, now this person is a critical sick patient. A person having a STEMI is as critical a patient as someone who got shot in the chest. That's
Time
the risk
is
of life.
tissue.
Yeah.
The longer we delay,
Yep.
the more cardiac death is happening.
So yeah, we want to move rapidly with those people.
What's a STEMI?
ST elevation MI, and all this ST elevation just has to do with the way we see it on the 12 lead.
Okay.
But it's worse than a non-STEMI, which is an ST elevation.
He's having a heart attack.
Is that an argument? It's an MI. But when you hear someone on scene say the word STEMI, it should elevate everyone to a degree of like, we need to get this guy out now because this guy might die in front of us. They are a sick, red, critical patient.
Melody, do you have a question?
Yes, sir, I guess. So you said like 40 and above medics are already coming for chest pain, but for the paper or like testing purposes, do we have to upgrade or say anything?
Yes. Yeah. So if you're doing a scenario,
we'll get to that.
Yeah, you don't need to worry too much.
We are crawling right
Yeah. So the answer is if you have a chest pain call and the person's sick, just get on your radio and say, dispatch 8171 medic for chest pain. Just get into that habit.
But you guys are already 40 or
40
If they're 40 and above. But don't worry about that too much because you're going to know that information as you're going to a call. You know who's coming with you. You got a little computer screen in front of you. It's like, okay, yeah, well, it's a new dispatch thing that's horrible. The worst thing that's ever happened.
So we'll get going, get to your stations, get set up. And like I said, so instructors for the medical, like here.
What's up?
Very strong. So take 15, 20 minutes to really walk them through.
As
And
long
then
as video.
With medical, it's practice. Practice questions over and over and over and over again.
What?
And then multitasking.